Thank you all for joining us this afternoon. My name is Maddie Bunting, and I am the Dean's Chief Student Ambassador at the UC Riverside School of Public Policy. I will be serving as your MC for today's online seminar with our special guests, Dr. Javier Santiago, Ortiz Correa, and Dr. Artur Borkowski, who will be discussing the impact of COVID-19 school closures on the nutrition of school-aged children. The first half of our event will be devoted to a presentation by our guest speakers. We will then devote the remainder of the event to an audience Q&A. For that Q&A, I have also invited fellow classmates to ask questions as part of a roundtable panel with our guests. Audience members, if you have any questions you would like to pose during the Q&A session, please do not send them via chat, but instead please use the Q&A feature, which you can find at the bottom of your screens. You can submit your questions anytime throughout the event via the Q&A feature. You do not have to wait until the audience Q&A to do so. Now, it is my honor to introduce our special guests. Dr. Artur Borkowski joined the UNICEF Office of Research Innocenti in December 2018. He is currently conducting research on the effectiveness of sport for development for children and previously worked on the role and prevalence of private education in South Asia. His research interests span education, migration, mental health, and multidimensional poverty and inequality. He also has a strong interest in climate change and environmental issues. He has a PhD in business and development from King's College London, where his thesis examined public-private partnerships in delivering education and training in Mozambique. Our other guest speaker, Dr. Javier Santiago, joined the UNICEF Office of Research Innocenti in March 2020. He has worked for international organizations since 2013. He has worked for UNESCO, UNDP, and the World Bank on projects concerning property crime trends, the monitoring and evaluation of the effectiveness of conditional cash transfers, the impact of industrial policies, and the evaluation of policing initiatives in cities to improve education outcomes. More recently, he has been a policy specialist consultant for the Global Partnership for Education, helping partner countries develop their education sector analyses and their education sector plans. Dr. Santiago holds a PhD from UCR and an MA in International and Development Economics from the University of San Francisco. Dr. Borkowski and Dr. Santiago, again, thank you so much for joining us today. The floor is yours.
Great, thank you, and thanks for having us. We're excited to be here and to be able to share this work with you. Just bear with me while I share my screen. Can everyone see that?
Yes, Artur.
Great, perfect. So I'll start by saying we're going to present a work that we did with colleagues at the World Food Programme, looking at the impact of school closures on nutrition of school-aged children. This emerged out of a lot of discussions internally, and it was really nice to work with colleagues at the WFP who have expertise on this. So let's see. Oh, okay, hold on. For some reason, okay, there we go. All right, so just to give you a quick it's a standard presentation. I'll just go over the context and motivations that drove us to do this work. Then what our goals were for actually doing this research, like, and what we wanted to achieve, and what the contributions were. Then we'll cover the data and methods we used, the results, and the policy recommendations that emerged from these results. And then just final conclusions to sum up. So to begin with, we know that nearly, or actually a little bit more than a quarter of the world's people do not have regular access to safe, nutritious, and sufficient food. And that this covers quite a broad spectrum. So there's people who sometimes have to skip a meal, who buy poor quality food instead of high quality nutritious food, to those that don't have any food at all, right? So we know that there's quite a spectrum of food security issues, and that countries experience a sort of triple burden, what we call the triple burden of malnutrition. So on one hand is the very publicized issue of undernutrition, which, people who you don't have enough to eat, or you're eating the wrong things. The other is obesity on the other end of the spectrum, which is also getting quite a lot of attention. And this is more prevalent in rich countries, but it actually happens, you actually see both coexisting in the same country, which is interesting, but also highly concerning, and tells you something about the inequality of the food system. And then there's also a third, less talked about component, which is sort of hidden hunger, which speaks to the quality of food. So it's not so much that you don't have enough to eat, but you're foregoing food that is more nutritious, that has more vitamins and minerals and so on. And this is actually much more prevalent than we think. So within that context, it's quite clear that there's a lot of food insecurity. Within the context, now, if you have some sort of disruption, food insecurity tends to go up. That's right. If you're already poor and you face a falling income, or the prices of food increase, or there's some shock to the food supply, which means you might not be able to get food, especially if you're located in a rural area or an area that's hard to reach, well, your food security is going to drop, basically, right? Because you have less access to food. What happens in a health crisis like Ebola, for example, in the 2014 crisis, is that this is amplified because and it also contributes to a greater inequality, because regions that are more affected by the disease are actually more likely to have a drop in food security, right? Because it's harder to get food to them, and all of these, all the effects of falling incomes and increasing prices happen more in those areas and less in others. And I'll show you a graph on this in a sec. And at the beginning of the COVID crisis, it was expected that the number of food insecure people, and we're talking about really extremely food insecure people, would double during the crisis. And now the crisis has gone far longer than was expected in the beginning when this projection was made. So it's actually probably quite a bit worse than that. So just to give you an example, in Ebola, during the Ebola crisis in 2014, which affected, it affected 3 countries. So you had Guinea, Sierra Leone, and Liberia. Those were the 3 main countries that were affected. And there was about 30,000 cases of Ebola that were recorded. And we did an analysis on the National Household Survey for 2014 and 2016, and looking at and combining this with the CDC statistics for Ebola prevalence. And what we found was that the regions that had high Ebola prevalence had worse food security, or accounted for more of the food insecurity in 2016 than they did in 2014, even though overall the country had higher levels of food security, right? So the disease is impacting more those regions which are obviously affected more by it, right? Now, this is all very well. It sort of gives you a household level picture, right? At the very high level. Now, sorry, no, go on, Javier, jump in.
Let me jump in. This data of Ebola is based from the Ebola data. It's based on a new technique that the World Food Program has been championing about asking what is called the food insecurity experience score. And this is a technique in which 8 questions are asked using the response to item theory. And based on the response you give to those 8 questions, you are classified as in the spectrum of food insecurity. And what we see is that variation of food insecurity got higher in the regions that were affected by Ebola. We're only showing here 4 of the indicators of the food insecurity experience, but what we saw here for these 4 can be also very true for the other 4 indicators. Go on, Art.
No, exactly. And so, what you'll note is actually what Javier said is very important, that this is based on people's access to food, self-reported access to food, right? So not having enough food to eat over the last 7 days, right? Or going a whole day and night without eating over the last week. So it's not based on their body composition, their height, their weight, or so on, right? It's on their self-reported access to food, which is important because in I mean, body weight and height and all of those sort of, and nutrient composition and so on take longer to adjust than self-reported scales, right? So anyway, this is a sort of a household picture, and you see that already we have, I mean, at a global picture, you have high levels of food insecurity, relatively high levels, and during a crisis, these are made worse, and that these actually affect the poorest the most. Now, being UNICEF, we're most interested in children because that's our mandate. Right. So now, looking at child nutrition, we know that there's actually quite a lot of data on child nutrition for children under 5. We have surveys like the multiple indicator cluster survey that UNICEF does, the demographic and household surveys, both of which ask quite a lot of questions on nutrition of children under 5. This includes what kind of food they eat, how often they eat. There's also a lot of height for age, weight for age. But this does not translate to children that are school aged. So there's a scarcity of data on children that are 5 to 19 years old. And we don't know very much about this age group. What we do know is that, well, the best estimates are that there's, I'm not going to read you the statistics on the slide, you can read those for yourself, but there is a significant number of thin and obese children. Now, thinness is not the same as sort of severe undernutrition and stunting as it's reported in under 5. So it doesn't have the same weight in a way, and the data, it really isn't there to calculate that, right? So again, I'm pushing this data scarcity because that's really important. And so, but regardless of this, there was an estimate from the European Commission in 2019 that the development and growth of 75 million children was impaired due to food insecurity in 2019. Now, this is likely to be an underestimate, but we don't know for sure. Again, because of this data scarcity, right? Now, nutrition in early childhood and in childhood in general is extremely important. More important than adults will say, because it affects later development, right? So what we know is that it can affect brain development quite significantly, and that there's long-term cognitive benefits for having, for example, proper nutrient intake of iodine, iron, zinc, so on. And that either over or under nutrition can lead to worse cognitive development later on. So, I mean, again, thinking about long-term impacts, you know, we're not saying that if you don't eat now, you're going hungry for a day. That's bad enough as is. But this has long-term consequences, right? And so not only that, it reduces their ability to read, write, short-term memory, self-regulation, which is actually a very key trait for later life success in the job market, for example. So very important to have proper nutrition as a child. I'm stating that as clearly as I can. And now, so we know, as a recap, that there's a lot of hungry kids, right? And that being hungry as a child is bad, right? It affects not only your current situation, but your long-term prospects, your long-term learning, and your long-term job prospects, life prospects, and so on. And, as we'll show later, also not only your prospects, but if you're a woman, your child's prospects in the long run. So we're talking about huge long run implications. Now, school feeding, which 370 million children globally participate in. And I mean, the biggest countries that have school meal programs, Brazil, India, South Africa, and Nigeria, make up a huge chunk of that 370 million, I think about 40%. So there's a lot of children participating in these school meal programs. And they usually come in one or two forms. The most common is school meals that are given in the school. And this is a hot meal that's served at school, usually during lunch, but sometimes at breakfast, depends. The other is take-home rations, where you're given sort of a food basket, which you take home and is cooked at home. And both have different benefits. For example, take-home rations, some benefit sometimes siblings of the person receiving the take-home rations, not just the person receiving them, and even family members if they're big enough, depending on the design. So conversely to what I said above, obviously, poor nutrition is bad. So if you're helping improve nutrition, you improve cognitive development and learning. You can reduce things like anemia, which is due to deficits, right? But importantly, also, as I said, in a crisis, you might have falling incomes, right? And rising food prices. So this would decrease food security. But school meal programs make up to 15% of daily family income for the poorest families in some countries, right? So obviously this would offset some of that, right? Some of that price increase. And they benefit primarily the girls and the poorest households. And as I showed, the world Aspire data set from the World Bank, which is a great public policy data set if you are interested. They reduce the income shortfall of people living, so the poorest, by 10%. Right? So it's obviously, this is a huge boost to people who are living in extreme poverty. Now, you probably have anticipated what I'm going to say next. Along comes COVID. Now, you've probably heard this before many times. There was huge school closures during COVID. You probably experienced those yourselves, actually. So, and at the peak of the crisis, there were 1.6 billion kids out of school, and schools were closed for prolonged periods of time. And with this, you saw disruptions to school feeding programs. So not only are parents or households seeing falling incomes as a result of the crisis because they can no longer go work, or spiking food prices because food supply is being disrupted, now something that might make up 15% of their family income has stopped, right? And so quite a lot of it stopped, right? So we calculated that around 39 billion rations were missed as a result of the crisis. Now, this is a rough estimate. It's likely to be more than this, but it's just a rough estimate because the data is rather patchy. So, but in any case, it's a lot, right? And again, you're having 370 million kids missing school meals, some for up to 6 months. Okay? And this is again, to reiterate, an important part of not only their nutrition, but their family's income, if you will, right? So now, we want to understand what's going to happen and who's going to be affected. Now, who's going to be affected, I've sort of given you a preview of that a little bit, right? But ultimately, we want to understand which channels the school feeding program, the disruptions to school feeding programs would have the greatest short and long-term impacts on physical and physical development and the educational outcomes of children. And so what we did is we systematized a very, very dispersed literature on school feeding programs, analyzed data from two of the largest school feeding programs in the world, and that's India and Brazil. In India, there's over 100 million children covered by the school feeding program. And in Brazil, I think it's around 40 million. And then building on this,
40 million.
40 million, yeah. And then building on this, highlighting the role, again, of the dual role of school, not only as a point for education, but as an entry point for well-being services. So again, school feeding being a well-being service, right? Because you're improving nutrition in addition to education, right? And also it functions as a sort of benefits transfer, right, as well. So now I'm going to hand over to Javier to sort of cover the data and the methods, and yeah.
Thank you, Arthur. And thank you all for being here too. So basically, we wanted to cover as much as we could of the crisis of the closure of the schools and the suspension and disruption of the school feeding programs around the world. And as Arthur indicated earlier, there's a scarcity and lack of data on the school-age children, but also there's a lack of data on school meal programs themselves. Despite being a very essential program for the welfare and well-being of the kids and their families, data on those programs is scarce, and when it exists, it's fragmentary, and it has issues of consistency and validity. However, there are some sources of data we could use. The first one was the Atlas of Social Protection and Resilience Indicator of the World Bank that gave us a global perspective of the incidence of the beneficiaries of the school meal programs. And at the country level, we went over many data sources. Our first instinct was to use the global school-based health survey conducted by the World Health Organization and the United States CDC, the Center for Disease Control. There were two issues with this data of the global school-based health survey. It would have been great, but they didn't have information about the schools and they didn't have information about the physical development of the students. We sort of could overcome those difficulties using the data from India that offered the height for age CS scores and the weight for age CS scores. Basically, you take the age and the weight of the kid, you make an indicator, you standardize by the World Health Organization has basically the standard of how that indicator has to be along an age distribution of kids. And then you know if the kid is above or below his age reference value. If it is below that age reference value, the kid is underdeveloped. And if the kid is above that reference value, the kid is overdeveloped or is developing better than his or her peers. We had that data for India, and the latest data from India was from 2011, 2012. The second data comes from Brazil, and the data from Brazil was very interesting because it gave us information about the student, the household of the student, and the school of the student. These three levels helped us to understand the connection between the implementation of the school program with the infrastructure of the school, with the household characteristics in terms of household composition and wealth of the household, and also the behavior of the kid in relation to the school meal programs. We use, as I said, the indicators for height for age and the weight for age scores, which are the internationally accepted indicators to assess the physical development of the children. We can go on the next slide, Arthur, if you wish. We did several analyses. Most of the analysis we did was descriptive statistical analysis, trying to cross variables to understand what was going on during this disruption. One of the first things we realized when we started doing this research is that governments were doing many things, but they were not reporting the things they were doing. There was a joint survey conducted by the World Bank, UNICEF, and UNESCO, asking governments about the responses to school closures, what they were doing with the kids, what they were doing with the school meal programs. And believe it or not, only a few countries responded to that survey. Furthermore, even though there were many national level initiatives or responses to the COVID crisis, there were also many local initiatives. And those initiatives were not properly captured. So we tried to, in the best way possible, to use a descriptive analysis just to try to see what was going on in the midst of all the crisis. And then we also use econometric analysis, conducting regressions, but we are not showing here causality. So we're not showing any causality between school meal programs and physical development of the school meal programs and welfare of the children. Why? Because these programs are not implemented randomly. These programs usually are implemented in a way that, for us researchers, doesn't allow us to look for any possible causality or externality to properly assess the effect of the program. However, our colleagues at the World Food Program our colleagues at the Multiple Indicator Cluster Survey at UNICEF, they were collecting surveys during the crisis period. So most likely we'll be able to establish some more direct causality during the crisis period when the data comes out later on this year. Arthur, we can move on to the next slide if you wish. So Arthur, I think you can take here with the global incidence of the school field probe.
Sure. Javier mentioned the Atlas of Social Protection. So this is what I call the Aspire database. Again, great source for public policy and sort of looking at the incidence of certain public policies and how they affect different quintiles, for example. So here we looked at the beneficiary incidence of school feeding programs globally. And so what this means is basically what percentage of each quintile, rather, of the total beneficiaries, how much belong to a specific income group, right? And so what we want, ideally, for this to be progressive, is that the poorest, or the poorest two groups, capture more than 40%, right? They're capturing a greater percentage of the bottom of the program, because they're the ones that need it the most, as we showed above, right? And generally, we find that's true. You'll notice, though, that in this list of countries, India and Brazil are not there, and they're the two biggest, right? So we want to know what's going on there too, and we did look at that. But it also, critically, it's that, as we already stated above, that the poorest are the ones generally that benefit most from these programs. Right? I'll just go to the next slide. Okay.
I can take here, Arthur. This is basically the descriptive statistics of the data from India. In India, the school feeding program is called the midday meal, and is implemented for children in the ages of 6 to 13. The India Human Development Survey, the one we use, had a very reduced sample of children of that of that target group for us, and we only have like with around 27,000 and 24,000 subjects, both in wave 1 and both in wave 2. Interestingly, sorry, you can see that the access to the midday meal program increased from wave 1 to wave 2, almost 10%, and that 10% went up. It's a 10% gain in a period of almost 7 years. But that is a trend that has also been happening anywhere else in the world, especially in the developing world. The school feeding programs have been increasing the reach, and more kids have been able to access to this program. However, there are problems in the access, and we will see access to the program is not all the story. You can move on to the next slide, Arthur. And you can take on here, Arthur.
Sure. So as you can see, I mean, so we have a lot of access to the program. Again, 100 million kids in India, and in theory, every child that attends a government primary school has access to the program. Now, as you can see, some people are not enrolled in the program, right? We can see these orange dots. And actually, what we find is that those that are enrolled in the program, those are enrolled in school and enrolled in the program, that actually take advantage of the program, are worse off than those that are enrolled in school and are not taking advantage of the program. And basically what this is showing you is that the poorest, those that need it the most, are self-selecting into taking advantage of the program. Right? They need it, so they take advantage of it. And so there's sort of more anecdotal evidence on this within India, and in India has a high percentage of private schools as well, or non-state schools, if you will. And there's some evidence to suggest that even the children that attend private schools, very low-cost private schools, will actually also enroll in government schools just to access the school meal, for example. So again, it functions again as a transfer, even when you're not attending a government school. Now, we don't know the scale of this, but it's important that the poorest are self-selecting into this program. Again, so just repeating the message, the vulnerable, poor are the ones that are benefiting from this. And Javier, over to you.
I don't want to burden you all explaining the regression, but basically the regression should confirmed and proved. Well, maybe in a quiz, I can ask one of your professors to use this table for a question, but no, no. But basically what we find is that access to the program is associated with lower physical development, both in terms of height for age and weight for age. And also we see that the level of wealth of the family more than compensates the effect of or the relationship of the access of the program. So here we're seeing that there are three things that are taking place. The poor or the worst of children are self-selecting into the program. Wealth can compensate for the possible access to the program. However, because of the scarcity of data, we don't know how the effect will be in the long run. That's basically what we're trying to say here. If children are self-selecting to the program, then the real effect of the program is something that has to be estimated using other techniques. Arthur, you can move on to the next slide if you wish.
Yeah, I just want to jump in and say, so while we're showing that the poorest are self-selecting to the program, we don't actually know how effective the program is, right? And how much of the school meal program children are actually getting, or if they're getting it at every school, as is theoretically supposed to be the case. And there's a lot of anecdotal evidence that suggests in some regions and some schools basically don't have the program, even though they should. And this due to lack of functioning infrastructure and various other sort of challenges, if we will. So now moving on to Brazil, and I'll hand over back to Javier here.
Thank you, Arthur. In Brazil, we use the Brazilian equivalent of the Global School-Based Health Survey, which in Brazil is called Pesquisa Nacional de Saúde Escolar. It's a very interesting survey because it includes questions about the school and about the household of the children. And there are two statistics that I think are relevant about what we found here in Brazil. The first one is that the access to the meal program is relatively high, 28%. But look at the percentage of people that always eat the food provided in the program. It's only 25%. And that's where things start getting tricky. The complexity of the program is not only providing the food, but guaranteeing that the kids eat the food for the program to be effective. The program here in Brazil is supposed to be implemented in all public schools and on those schools that are part of agreement of public and private organizations. And if we move on to the next slide, Arthur. We're going to see starting why infrastructure is important. We see that when we look at the data at the school level, when we look at the schools where these kids are going, we see when we compare the GDP per capita of the municipality where these schools are located, that having certain items such as kitchen, water grid, for water provision, having a warehouse for storing the food, access to public sewage system in terms of sanitation services, having a dining hall. Poorer schools tend to underperform the schools in the richer municipalities. That is, the economic difference in terms of income is translated in a difference in terms of infrastructure at school. Why is this important? Because during the school reopening, a lot of hygiene and a lot of sanitation is going to be necessary, not only for kids to return back to school, but for them also to be able to have access to the food program at school, to the school meal program at school. If the schools do not have the right infrastructure, they cannot properly operate a school feeding program in the context of a school reopening where all sanitation and hygiene measures are going to be heightened and increased. Additionally speaking, when we go to the second graph, so having the access to the school meal program is not the whole story. Why? Because you see here that eating the food depends on what? Income. The poorer the child is, most likely the child is going to be eating the food all the time. The richer the kid is, most likely the kid is not going to be eating the food provided in the program all the time. And there's a lot of anecdotal evidence about that, not only here in Brazil, but in other countries of Latin America. This means what? This means a challenge for the public policymakers for them to try to address how to properly and effectively deliver the food to the children that need it the most, to avoid waste and to have programs that are more efficient and more effective. Arthur, you can move on to the next slide. And now another difficult table of a regression. But the regression has two things. The first one is that the big effect of having a school infrastructure for the provision of the school meal program. The coefficient for having a kitchen at the school is very large. It's very, 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 very large. Not like that, the coefficient for having a dining hall, which becomes negative. So similarly, having a dining hall reduces the probability for a child to eat their food provided at school. This was something we addressed in a way that highlighted the issues of monitoring the implementation of the school feeding programs. I'm going to make a parenthesis here, and I'm going to tell a little story. When we were checking the actual coverage at the municipality level, at the city level of the school feeding program in Brazil, we found for a large number of municipalities that they were like serving 150, 130, 140% of their students. So how come they are serving 40% more people than the students they have? It's just because monitoring these programs is very expensive when you don't have the right resources. And when the schools are in the rural area or in very distant cities. If it is difficult to monitor the program, just imagine how difficult it is to have the right infrastructure in place for the program to properly operate. You can move on to the next slide, Arthur.
Just a parenthesis to say, keep in mind that Brazil is currently undergoing a huge corruption. I mean, there's a huge corruption investigation underway in Brazil, right? That has snagged lots of. So keeping that in mind with this over-reporting of the number of children in school meal programs or receiving school meal programs may have something to do with it. We can't show that, but I mean, certainly this over-reporting is worrisome, I think. So we're moving on to sort of, now that we've shown you basically that not only is it the poorest that are self-selecting into the program, it's also when they participate in the program, they're more likely to eat the meals they receive from the program. And the benefit to them is by far the largest. They're the ones that need it the most. So now, as we said, COVID stopped that. So what did governments do? Well, so you couldn't do in-school meals, which is mostly what we've been talking about, right? Both Brazil and India have in-school meal programs where the meal is provided in schools. So they moved to two solutions. Well, we can 2 or 3, depending on how you classify them. So the take-home rations, which, as I said, you get sort of basket that you take home, and then cash transfers. And now you have unconditional and conditional cash transfers. Now, Brazil has one of the biggest conditional cash transfers in the world, and that's the Bolsa Familia program, which is also related to education. But so I think in Brazil, actually, they incorporated an additional food voucher program into the Bolsa Familia at some point, but it depended at which state. So again, from a public policy implementation perspective here, the national government made a policy, but the states implemented different policies to the ones that was mandated at the national level. So you had different responses to the crisis. Some had cash transfers, others had food vouchers, others appended to the Bolsa Familia program. So various differences. Obviously, there's differences in how effective a cash transfer can be. The more generous, predictable, reliable, they have greater impacts on food security and nutrition. we know that. But the evidence on school meals is much stronger and more complete than it is for cash transfers, at least on nutrition outcomes. Right?
Arthur, let me jump in. There's a very important point about the take-home ratio. When you give food to the kid to take home, we don't know what's happening in the intra-household bargaining. So how that food is going to be distributed about all the household members. When the food is served at the school, well, it is expected that the kid is going to be the food served at the school. Not all the time, as shown in the case of Brazil, which is also a very alarming reality. That's the problem of the conditional cash transfers and the unconditional cash transfer. You give money, sometimes in a prepaid debit credit card, to a child for his family to go buying food, but how much of that food, the percentage of the share of that food that goes to the children or to the child enrolled in the program, we don't have any evidence yet. So what that type of response was effective for the children, we still do not know. You can go on, Art.
Sure. So, I mean, in terms of policy recommendations, sort of building on that, and I mean, we're getting to the end here, so we won't bore you for much longer. I mean, there's obviously a need to adapt the response to the logistical capabilities of the government. I mean, and what we've been seeing is sort of decentralized responses to the crisis. And that's actually quite critical for this adapting to logistical capabilities. And so it's very important that that continues to be the way forward. But as we said, the alternatives to school feeding, school meals, are not as well established at having strong effects on nutrition outcomes. So what we need to do is prioritize safe school reopening, and do so in a way that, well, that not only targets the kids that were already in school, but targets the kids that were most likely to drop out of school. So we know that any disruption, for example, in the term, even summer terms, teacher strikes, any sort of disruption in schooling leads to kids dropping out, or increases the probability of children dropping out. And again, those dropping out are the poorest. And we know that school meal programs are actually quite effective at bringing kids back to school.
Back to school, yeah.
Because, you know, why don't the kids go back to school after the crisis? Well, they might have been needed to work, for example. They might have, and if that is the case, well, if you offer them a school meal then that's one less meal the family needs to pay for. And that might be more efficient than them having to go to work, right? So it actually critically important, especially for girls. It has the largest effect for girls. And not only that, we just showed you that sometimes these systems don't work very well. They don't target the right kids. There's some waste going on. So it's an opportunity to actually build this back better. And this has become a catchphrase, but I mean, it's actually a golden opportunity to improve the way these services are delivered and ensure that they're actually doing what they're intended to do. Right? Now, that's hard, obviously, but there's an opportunity to do that. And Javier, unless you have anything to add, I'll go to the next one.
I wanted to say something about the children out of school. The crisis was already bad for children out of schools and learning poverty before COVID. This is going to be worse as a consequence of COVID. Bringing those kids back to school and to go over the huge learning poverty crisis that the world is facing is going to imply a multi-sectoral policy response. And child nutrition is going to be here like in the forefront. And it's going to be very complex for governments. We already have some evidence about the negative consequences of this in terms of child protection. There's some evidence that like early child marriage has increased in some regions of Asia and Africa too. So this is going to be bringing the kids back to school. If governments cannot put together a safe school reopening, this crisis is going to get worse over time. Back
And
to
I mean,
you, Arthur.
just sort of riffing on that and saying that, so the learning crisis was worst among the worst off, right? The worst off are also the least likely to have access to remote solutions, whether that be internet or radio or whatever, right? So they're only falling farther and farther behind as a result of this crisis. So bringing them into schools through the school meal programs or however else is critically important. And just a final point here to say that the school meal programs are sort of a two-in-one, two birds with one stone, if you will. You're not only improving nutrition outcomes, you're bringing kids back to school, right? So that's, again, thinking about it a bit more broadly, I think that's a very important point. And so
Arthur, and there is something that has to be said here. School meal programs have proven to be beneficiary for the communities. Some countries in Latin America have been using local production to get all the supplies for the school feeding program. So that has become also like a source of constant income for the small farmers in the communities. So this has been a huge disruption. This has been a huge disruption. Sometimes the responses didn't work as expected. In some countries, there's a lot of evidence reported on this. They gave prepaid credit cards, but then the vendors didn't have the credit card machines to make the transaction. So what did families did? How did they do without being able to spend their money? So that is something that has to be considered too. There's no one-size solution for all the countries. There's not even a solution at the national level, as Arthur was saying. Every single city, every city state in many countries have to come up with its own strategy, and that is something that has to be considered when this is going to be back. How to build back better these meal programs. So to conclude, Arthur, do you want to go over the conclusion? Okay, so basically, I'm going to take back from where Arthur left. School meal programs are intertwined with education, and we have to see schools more than a provider of education, but a provider of welfare and well-being services for the children. Health, nutrition, empowerment, and also learning. That is one of the main tasks of the schools. As we were discussing, governments, I think everyone, if we were surprised by the extent and the length of this crisis, most governments were too. I'm not going to dwell on this. You read the news. We're still paying the consequences of that. But in terms of the welfare and the well-being of children, the full extent of this disruption is still to be measured and is still to be known. We had some evidence about the negative consequences and effects of school closures for heavy snowstorms, teachers' strikes, civil wars. But this is the first time that all schools closed. And they didn't close for 1 or 2 months. No, they closed for a long time. So this is a very difficult thing, and more data is needed to fully know what is the real consequence of COVID. Monitoring and evaluation of school meal programs, that is something the World Food Program has been emphasizing since the beginning of the crisis. If that was important before, it's going to become more important afterwards. Most likely, when the schools start reopening and these programs start being implemented on site again, the nutrition reality of these kids is going to be alarming in many places. So how governments are going to respond to that, what kind of additional programs, supplementary programs they're going to have, how are they going to monitor that these programs get to the children that need it the most, is still to be known. And I think that is going to be the next round of studies that are going to be undertaken on this study. Very important, I think everyone knows here that the first years of life of a child are critical for his or her physical development. A child that is with bad nutrition will have very bad physical development during the first 2 to 5 years of life. However, there is an opportunity. There has been, and it's proven that time period of school age, like late childhood and adolescence, can be used as a way to compensate for the problems in physical development in early life. So that's why the World Food Program and other international development partners are championing what they call the 8,000 days of life as the real-time window to undertake and to implement these nutrition interventions to improve the well-being and the health of children. And that's going to be done, that's going to be implemented where? At school. And finally, the Build Back Better approach will not only imply serving the kids that need it the most, bring back the skills that are out of school, retain the kids that are on the verge of dropping out of school, but also make sure that the school programs are going to be resilient because they have to be prepared for crises like this in the near future. And Arthur, I think that's it from us. And if you don't mind, Arthur, I would like to thank Professor Ariel Dinar, who invited us. Professor Ariel Dinar was my dissertation advisor when I was at UCR. And I also want to thank Dean Anil Diolalikar, who was also a professor of mine when I was at UCR, for his kind invitation. Thank you, Professor Dinar. Thank you, Professor Diolalikar. Thank you, everyone at the very famous School of Public Policy. I remember when the School of Public Policy was getting in shape at the early ages. Thank you for inviting us. It's a great pleasure to be connected again with UCR. Thank you.
Yes.
I'll just stop sharing my screen now, just so we can actually see each other, because I can't see anyone.
Sounds wonderful. Yes, thank you both so much for joining us. I know Professor Dinar is in the audience. I know Dean Diolalikar was so thrilled to have you both here. So thank you for joining us, and thank you for your presentation. At this time, I'd like to introduce my fellow classmates who will be joining me on screen. We have Arlette Flores Aparicio, Joanna Arias, Jenny Chen, Kevin Karami, and Laura Shah. They'll be able to pose questions directly to our guest speakers. I will be also posing questions we receive from our audience members. So I would like to take a quick moment to remind those in our audience to please submit your questions via the Q&A box instead of the chat box. I will go ahead and monitor that. But for now, we do have our very first question from Joanna.
Thank you, Maddie. Dr. Vakowski, Dr. Santiago, thank you for breaking down such a complex issue. Although we were focusing on the crisis on a global scale with many schools closed for in-person learning, and while that also limited children's access to free reduced price meals, as you both mentioned, children's food insecurity has certainly grown to a very high level. Do you believe more on a national level that the U.S. federal safety net needs to be strengthened, more specifically by increasing SNAP, the Supplemental Nutrition Assistance Program?
I'm going to go ahead and say I am nowhere near qualified to answer that question because I don't know anywhere near enough about it. My instinct would be yes. I mean, always. Yeah, I don't know enough about it, so I'm just not going to say anymore.
I will say something from a general perspective. Even if we take COVID out of the picture, there's still a task to be done to improve food security, even in developed countries, and especially in these middle-income countries. And that has to be. What we saw in other discussions we have with our colleagues is that no single policy is going to solve that crisis, and it's going to be a long-term effort. It will imply, yes, economic growth. Yes, it will imply more job security, but it will need also some sort of assistential measures when really necessary. So it will be in the end a combination of policies at a different pace in every country, but it's going to be still a long-term effort.
Perfect.
Just wanted to quick. I did a quick Google while Javier was answering, and it seems like there's 10% of the U.S. population that is not food secure, which in this case means that does not have enough food for an active, healthy life for all household members. I mean, in that context, any help, the more help, the better to those 10%, right? So again, don't know the extent of the SNAP program, but again, the more the better.
Perfect. Well, thank you, Joanna, and thank you to both of our guest speakers for your responses. I do believe Kevin has a question.
Thanks, Maddie. And thank you, Dr. Borkowski and Dr. Santiago. I think that was not only an insightful presentation, but the issue is so underrepresented that I think we need to talk about it more. And my question might be a little bit more on the boring side, but I think it's still really important to talk about. I know you guys went over data sets and all of that a lot. My question is why, the first part is, why is there such a lack of data in certain fields? So like, for example, you mentioned a lack of data in child nutrition. Like, why does that exist? Why isn't there more research being done in this area? Because it is a really massive area, and the numbers you presented were huge. So it's not affecting a small population. It's a very large population. So like, can you just elaborate on why there's such a lack of data?
Yeah, sure. That's a tough question, to be honest. I would say first and foremost, collecting data is extremely expensive. And to do it well is even more expensive. And it requires quite high human resource capacity. So a lot of the data that's collected is connected by international organizations, the kind that we use for food security stuff. There is data collected at a national level through household surveys and so on, but this depends highly on the statistical capacity of given governments. And they understandably focus perhaps more on issues related to income and household food security rather than focusing directly on the children. Now, it's also not clear what exactly the tools would be to collect the data from children between the ages of 5 and 19. Again, we can use height for age and weight for age, but that's quite, time consuming to measure, because you have to get the height of the child and the weight of the child, and you have to do it several times in order to make sure you've done it right. And it's a little bit awkward and intrusive, right? So, and already these household surveys are quite long. Most household surveys take between 45 minutes and an hour and a half of the household's time. So again, they have to focus on the things that they think are the most important. And until now, this hasn't been that, right? Focus has been more on the household level. Javier, I'm sure you have more to say on this.
Well, what I will say, I completely agree with what Arthur said. Okay, the cost is the main obstacle. Very expensive to collect like physical development indicators. There are many cases. I'm not going to say the country that conducted the DHS, the demographic, the DHS survey, the household survey
Demographic
about health.
survey.
Health survey. Thank you, Arthur. I always forget what it means. And they collected the physical development indicator, the height for age and the weight for age, but then they have to discard it because they were done in a very inappropriate manner. So that's an issue. But there is also another issue besides being very, very expensive and being very technically difficult. I think there's an issue about the political interests of governments, and the priority was given to the physical development of the children before the age of 5, because we are still giving a fight against child mortality and infant mortality. So that has been a political priority in the development arena for around 40, 50 years. And the interest and the health priorities of the children in school age is still very secondary. So it's going to be a very slow transition, but that transition is going to be taking place at some point.
Yeah, maybe just to add, there's also a path dependency in this, right? So we used to collect data on this, we continue to collect data on this, and we don't necessarily change as quickly as we should, perhaps, right? Because that's what we're used to collecting. Those are the indicators that we can track over a long period of time now. And so that's nice to have, but the mindset to actually change is a little bit slower, I think.
you both for the response. I do have a quick follow-up, and it's a bit of a hypothetical, but I do want to hear your opinions on it. I think most people would probably agree that there is an incentive for governments to do this kind of research because, the benefits of figuring out, the young parts of your population. I think that there's an incentive for governments to know what's exactly going on. So if that incentive exists, do you think there's like a policy, like a way for policy to be the kind of the solution to this problem in terms of data? Like, is it possible for governments to maybe, you mentioned the cost as being the main issue. Is there a policy solution to solve that problem or maybe like to remedy it? Because I do think that there is a lot of reason for governments to maybe actually invest more in this area, or is it just still too much? Will policy not cut it?
I will just make a quick comment before handing over to Javier because I think he has a lot to say on this. But I think that while there is a lot of reasons for them to look into this, there's also a lot of reason not to, right? You might not want to report how many school-age children are malnourished in your given country on robust indicators. It may be better just to estimate and say, well, and then you can always say, well, it's just an estimate. It could be wrong, right? There are also incentives for that. So the balance of incentives is not as clear. But just to throw that out there, that there are also perverse incentives, right?
I don't, well, there might be a policy issue there, indeed, but I think technical capabilities are still the main factor preventing collecting this data. And we haven't found the technology to do that in an effective and cost-efficient way. We know how to collect household data very well now. And to implement household surveys around the world, perhaps the price or the cost has plummeted by 50% over the last years, because now every survey is collected in a phone, is directly sent to a server, so the server process, boom, the survey is ready to use. But then you cannot use a phone to measure someone. You cannot use a phone to see if the person is actually eating the food. It's as difficult as how governments have not been able to properly have administrative records about the school attendance, and for how long they have been running schools in history, like 1,000 years perhaps. So this is an area that really demands that there has to be like a technology innovation that reduces the cost to be able to have more data about the school-age children.
Also, it's very much about technical capacity as well, right? And I mean, international organizations have a role to play there in doing capacity building and so on. But a lot of it is, I give an example without naming the country. There's information management systems that track basic information about schools, enrollment, disaggregated by, I don't know, sex, age, disability, and so on, the number of hours teachers work, and so on. And this is self-reported from the school, right? The school sends this to the government. Well, the school has a perverse incentive here, one. And two, the head of the school, who's the one reporting it, might not have the technical capacity to actually report this, right? So even in such basic administrative things that do have the potential to incorporate things like this potentially, it's very difficult from a technical capacity standpoint.
If I may actually jump in with a question, it's somewhat similar. When you both were talking about infrastructure and even the basic, a working kitchen and just the basics to feed these children, any thoughts on oversight by the international community, versus what's going on the ground in these local communities? Should we leave it to them to figure out what works best for them? And I know Dr. Santiago, you were saying, one size doesn't fit all. So what role should the international community and even UNICEF play in this?
That's a tough one. Because, as we say, I think around things like utilization of funds, was very much a national, subnational community issue. And there's some research showing actually that community engagement in, I don't know, schools or whatever, is actually very effective at preventing misuse of funds. And so I don't, from like a diversion of funds corruption standpoint, I think the international community, as long as it holds the anti-corruption norm and measures levels of corruption more or less, that's enough. I don't think there's an active involvement for that. In terms of supporting governments to do these programs well and to design programs and to monitor these programs, I think there's quite a lot of scope there. For example, data is expensive to collect. International organizations can help governments financially or technically to collect this. And that's partially what they do, right? So there's scope there, but from the sort of corruption, misuse of funds, infrastructure perspective, in normal context, I would say no. In a context where you have a crisis or a disaster, where you have a big humanitarian response, there you actually see quite a lot of infrastructure building and so on by the international community, right? To help fill the gap, as it were. Yeah, I'll stop there and let Javier.
I want to share a personal story, and I know that this shouldn't become like this, but I grew up in the fields in Colombia. I grew up high in the Andes, close to Medellin, in a little coffee village called Palmitas. And the school meal program started there in the late 80s. And they opened a school kitchen that remained closed for almost 10 years. Why? Because the kids were the kids of the little village. And for them, when they have the break, like the breaks during the day, for them to eat, they didn't eat at school. They went walking to their houses to eat. And the food that was prepared at the school stayed in the kitchen because the kids during the break went to their houses. So this is not only a matter of local solutions, but also understanding the local traditions and how societies operate at the most local level. For some kids, for them, it's sort of like, I'm talking about Latin America, especially in the rural areas. They don't bring the food from home to the school. They go walking home again during the breaks because they can help a little bit to the parents, let's say, gathering coffee, gathering some other plants, stuff like that. So understanding the local conditions is very important. However, there is something that has been proven very effective. Knowing the best practices somewhere can help solving the crisis at a very specific place too, because some contexts are not the same, but they are similar. So one of the things that the World Food Program has been doing lately, just like sharing best practices of the school feeding programs around the world for policymakers to know what they can learn from other experiences.
Wow, what a wonderful point about context, and just thinking, oh, I went to school with my lunch packed in a little bag, but maybe that's not what happens everywhere. Maybe they go home. And so, yeah, what a wonderful point. I hadn't thought of that. Thank you both. I do believe Laura has a question as well.
Thank you, Maddie. So one of the policy recommendations that was proposed was to, it was the second policy recommendation. It had to do with, I'm so sorry. It had to do with reopening schools safely. So do you think that it's going to come down to an equity issue in terms of how schools reopen safely without, because some schools might have more resources than others, and right, some of the things we mentioned previously about countries, not all size fits all sort of thing. So what are your thoughts on that?
Yeah, I mean, there's definitely equity issues. I mean, and I think that's exactly the role of the government, is to ensure that some of these equity issues are overcome. I mean, obviously schools in poor neighborhoods and poor cities, as we showed in the Brazil case, have less infrastructure and less ability to open in a case where there has to be social distancing measures, there has to be better hygiene measures, otherwise the kids will get sick, right? So there is definitely, that's exactly the role the government should be playing. Whether the governments will play that role, I mean, that depends on the context, the country, and so on. I mean, they obviously want to, whether they have the capacity to, and so on, with all the other demands on them at this time, right? For financially and so on. That's also, you know, it's difficult. I think, and I don't envy any government now having to deal with all of these different policy issues at the same time and having these, I mean, quite tremendous financial constraints. So yes, an equity issue for sure. How it's solved, target the poorer areas with more money, more finances. I don't know, build tent schools outside the schools so there's more space. There's lots of potential solutions. What works, again, depends on the context.
I will jump in and I will say something that I don't know if it's going to be politically correct or not. But I think the issue of equity is not only for reopening. I think the issue of equity is also for having more resilient education sectors and education systems around the world. What this crisis show is that we don't have resilient education sectors. And within that resiliency, that we don't have an education sector and education structure that addresses like very, very, very critical inequalities in the students. We saw that with online learning, how there's still a huge digital divide that is going to increase learning poverty around the world. And we talk of internet, right? Like, no, okay, some kids, they don't have access to smart devices, and poor kids, they don't have access to internet at home. But let's go back to something as critical as electricity. I'm working on a project with refugee children around the world, and only like 30% of them have access to radio and TV at their shelters. So the issue of equity is not only about reopening, but it's also about having more resilient school sectors. A school sector that cannot only deal with crisis, but that they can also deal with a new way of learning. Because if COVID is showing something good about, I mean, we can say that COVID brought something good. I'm not saying that COVID is good, okay? But if there's something we have to learn about this, is that the education sector has to change.
And also, I mean, just to add on that, it's the inequality has happened already, right? So it's not only in the safe reopening of schools. Those kids going back to those schools that have worse infrastructure are the ones that have fallen behind the most because of exactly what Javier said. They're the ones that don't have access to electricity, may not have access to a radio, don't have access to the internet, had no way of keeping up with their schoolwork. Their parents might not be able to help them with their schoolwork, right? So in terms of educationally, they're far behind. Nutritionally, their parents might have not been able to feed them as much. So they're also falling behind. They have already fallen behind. So it's not only about how do you make the schools open equally safely, how do you help those kids catch up? That's tough, I think. And there's a lot of work going on how that should happen, but it's a big question.
Yes, I think these next few months and in the beginning of fall, when students do return, will be interesting, and I'm sure you'll probably be going through a lot new data here soon to see how that turns out. Jenny, would you like to pose your question next?
Yes, thank you, Dr. Bukowski and Dr. Santiago for presenting to us today. My question is, once the evidence is collected and the research is complete, what are the next steps UNICEF takes to advocate for the implementation of the policy recommendations proposed? And if there's any pushbacks, what might they be?
All right, it's a big question. You guys had tough questions here. Right, so at UNICEF, I mean, we work very closely with the regional and country offices, or as closely as we can. So, and we partially get our data from them. We make sure that what we're trying to say is true according to what's happening on the ground. And so whatever policy recommendations come out are fed back through the same channels. And we make sure that our policy recommendations align with, I mean, what the country offices and regional offices think. And same thing with WFP. I mean, again, remember, this is a work with the WFP, and they're very much trying to implement these policies in their own school feeding programs. And their school feeding programs are among the biggest in the world. So, I mean, it is trickling down. With the pushback, I think the obvious pushback that is going to happen is the financing side. And what do you do about that? In this case, I would say it's fairly hard because there's as I say, there's so many competing interests. And the cost effectiveness of school feeding programs has been very difficult to show, mostly because cost effectiveness requires a comparison point, right? And school feeding doesn't have a natural comparison point. You can compare it to other education interventions, but it's not really just an education intervention. You can compare it to other nutrition interventions, but it's not only just that. And so there hasn't been a lot of like really clear work done on that. So I think the case is a little bit harder to make, but there's definitely, I think WFP and UNICEF definitely are pushing that to happen. Whether it happens at the government level, again, in India, the Supreme Court ruled that all states have to submit what they're doing in order to, what they're doing in response to COVID, re the school feeding programs. So there has been national pushes to make sure that these policies are happening. But yeah, I mean, that's hard. Javier, over to you.
Thank you for the question. That's a very important question. One of the things that have been like going on in terms of the policy dialogue is how to open schools, how to reopen schools safely. And UNICEF has been advocating for prioritizing school reopening, but doing it in a very safe way, not only for the students, but also for the teachers and for their families. The policy discussion is going on, like basically every week, there's a sort of recommendation about how to reopen a school, when to reopen schools, for whom to reopen schools. This is an ongoing dialogue. This is a very, it's like something is happening every day. Mm-hmm. Something new is happening every day. And in terms of the pushbacks, it's basically the implementation of those guidelines. There are some cases now in let's say in Mozambique, where the government had a clear agenda to reopen schools, but then they discovered that the devices they got to measure the temperature and to control the temperature of the students and to the faculty, they are not working efficiently. So then they had to stop the reopening for a while for them to reassess it's a very liquid and flowing situation. Things are changing and happening all the time. But the only thing of being advocating for safe school reopening, of addressing the huge digital divide about the access to remote learning, to advocate for using alternative solutions such as radio, TV, printed packages of printed material for the students, using all the possible channels of food distribution for the children. That has been a huge contribution for the policy innovation that has been taking place over the past months. And certainly there are going to be a lot of financial constraints, but overall, it's good to know that policy discussion is taking place.
And just to add, I mean, what is definitely true of UNICEF is that the country office colleagues have very close relationships with the government. So there's a constant dialogue, and the government is often asking UNICEF country offices what the best policies are, and for recommendations and so on. So there is definitely a path to policy influence and policy implementation, and there's all sorts of hurdles in the way, as we've mentioned. But I mean, I think, we hope that we'll have better policies in the future, right?
Yes, thank you both so much. And I know, sorry to throw another tough question at you, but I do believe Arlette has a really great question.
Thank you, Maddie. So what I've been hearing a lot from this discussion is like, what are the long-term effects? And I was thinking a little bit of like, do you believe there will be a challenge when it comes to life expectancies because of COVID-19 and because they are children malnourished, and how this might affect the country's workforce or the hopefully increase in their GDP?
Another tough one. Yeah, that's a very good question. So let me recap maybe some evidence. And we know, for example, that there are correlations between education and later job earnings, but also maternal and parental education to the nutritional status of the children. And so if we're talking long-term effects, if now let's say a girl dropped out of school earlier than she would have and is not going to go back to school now, right? So instead of having primary education complete, she dropped out halfway through primary. That's going to have long-term effects on her kids. And that's going to happen 20, 30 years down the line. And that might have compounding effects down the line, depending on what happens. So yes, very much long-term effects, and that will have effects on the workforce to some extent, right? They will not be, because again, lack of nutrition has effects on cognitive development, learning, literacy, reading, so on, right? So they will not be as capable as they otherwise could have been, right? So maybe they wouldn't be as, I don't like the term, but productive as they could have otherwise been, right? So that has long-run implications for GDP growth. And yeah, I mean, yeah, it's just, I think it's a nightmare really, but never mind. Javier, over to you.
Yeah, thank you. Well, because this is an ongoing crisis, we cannot see where things are going. But this is like what? Like perhaps one in a time crisis. The last time the world faced something like this was like 100 years ago, and it was a very different world back then during the Spanish flu than now. So we know where things are going, but I don't think we already know what is actually going to happen. But you mentioned something about life expectancy. I think when things are over and when we know the actual number of excess deaths of this crisis, then we will have the real estimates of the life expectancy. Not only Arthur was mentioning something about how the mother's education becomes a mechanism of transmission of intergenerational effects and education, but we also have to think that governments are highly indebted because of this crisis. And usually the debt passes on the next generation and on the next generation and on the next generation. And well, I don't have kids, but if I ever have one, so he will have to take on the debt that the government incurred for me. But I think there is also another effect that, and we were discussing, I think it was one of our meetings, Arthur, that many things for daily life are going to change now forever, and perhaps the effect is going to compound over years. Education is going to have long-term effects. If the educational sector was not working properly before the crisis, then we know it didn't work properly during the crisis. We know that it has to change after the crisis. And in terms of growth, we hope that governments are going to have in place the right fiscal and monetary measures to reignite the machines, because we already lived in a very difficult world, plenty of inequalities. If COVID came to enhance and increase those inequalities, then the political environment is going to get more difficult to put policies in place. And that's a problem too. When you have a lot of political turmoil, you cannot put the right policies in place because there's a lot of confusion. So that might be also like a long-term effect.
Also, just to add, I like when Javier speaks, it always gives me time to think, and he always says something interesting. So, I mean, there's an important point here. Thanks. There's an important point here that poor nutrition increases the probability that a child will die from things like pneumonia. And COVID has a high incidence of pneumonia, and there's no reason to suspect that that wouldn't be true for any COVID symptoms, right? So the life expectancy question is good, but I think a little bit different framing is the inequality in life expectancy, right? So the undernourished, perhaps those that were undernourished before the crisis might have a lower life expectancy now, like the poorest, than they did before the crisis. It might not affect the richest that much, right? So I think that inequality in life expectancy, like the inequality in everything else that we've been discussing, is maybe one of the saddest points that comes out of all of this, is that actually COVID has drawn out these inequalities farther than they were before. And part of the process post-COVID should be to bring them back as much as possible. Whether we do that or not, that's hopefully, but who knows, right?
Now I know how to restructure my question for the next webinar. Thank you.
No, it was a great question. It just occurred to me that that inequality bid is something that I think we haven't perhaps gotten enough of, but I think it's critical.
And that's going to become the next trend of research after COVID. How COVID interacted with already existing inequalities, economic, social, regionals, all over the world.
Yeah, and keeping in mind that COVID produced the first ever drop in the Human Development Index, or projected drop in the Human Development Index, since 1991. So this is a huge effect, and couple that with the growing inequality, it's a recipe for unpleasantness, basically, and the extent of that we don't know yet, unfortunately.
Wow, that was quite the last question, and I'm so sad, but unfortunately that is all the time we have for questions today. I really cannot thank you, Dr. Borkowski, and you, Dr. Santiago, for your presentation and for answering all of our questions. I also want to thank everyone who attended today's webinar. Our next online event will be on Tuesday, May 25th at noon Pacific, when we host the next installment of the Water Seminar Series, which will be on the Fox Canyon Water Market, Lessons Learned in SGMA's First Groundwater Market. You can learn more about UCR School of Public Policy events like this one by visiting spp.ucr.edu. You can also learn about our new forthcoming BA MPP program launching fall 2022 on our website. We hope to see you at future events hosted by the UCR School of Public Policy. Until next time, goodbye and have a great rest of your day, everyone.